98% of the procedures that we do or that I do, the patients, when they come a week later, they tell me, I'm surprised it didn't hurt, okay? But I can't promise that to everybody, you know. The procedure itself, I promise that won't hurt, okay? It's the after effects and the healing process. But that's one of the main questions. Then of course it just becomes into what are the options and you know, time, how long does all this take? And you know, most of the time, my response to the patient is, you know, it's taken all these years for you to get to where you are now. There's a reason why we're there, okay? So we need to work on changing why you got here, okay? And then fixing the problem. And that kind of gets them to understand, you know, like patients will come in and they're smokers and I need them to stop smoking, you know? And I just had one that came in last week to have her records done, who the day that I did the consult, and that was maybe 3 weeks ago, she flat out said, I can't quit smoking. I just won't do it. Well, she called and she came in last week, she's ready, you know, and I made it clear, smoking has to stop. And she did, because she just felt like this was the time to get this taken care of. So yeah, pretty much, you know, they asked me about pain and they asked me about how long it's gonna take. And then from there on, it's just a matter of them getting comfortable with me and our practice in general. You know, I give them the option of using sedation, and interestingly, for years, I've never done IV sedation, which is something that a lot of people ask for and a lot of people want. My son joining the practice, and he is IV sedation certified, we're now going to offer it. But surprisingly enough, most patients, after speaking to us and after understanding how the whole procedure is going to work, they get eased up. I mean, I had one patient flat out tell me, you know, I'm not doing this unless I have IV sedation. And this is before I was offering it. So I sat with him, I told him that I'm sorry that I'm going to have to give you your money back. He had already paid and everything ready to go. And I'm going to have to give you your money back because I can't do it under IV sedation. And all we can do is oral sedation. And after talking to him for a little while, he decided he wanted to have it done here. So he did, and we did it under oral sedation, no IV. And afterwards, he just said, I'm really surprised that this worked out the way it did. So yeah, anxiety is a big one, but in most cases, it gets taken care of pretty much right after the consult.